Welcome, everyone, to the 2018 National Lead Poisoning Prevention Week webinar series. Each year, the U.S. Department of Housing and Urban Development, the U.S. Environmental Protection Agency, the Centers for Disease Control and Prevention, and our partners collaborate on a national outreach effort to observe National Lead Poisoning Prevention Week, held this year from October 21st through 27th. National Lead Poisoning Prevention Week is an annual call to action aimed at bringing together families, individuals, community-based organizations, state, tribal, and local governments, and others to increase lead poisoning prevention awareness and to increase efforts to reduce childhood exposure to lead. National Lead Poisoning Prevention Week also highlights the many ways parents can reduce children's exposure to lead in their home environment and prevent its serious health effects. This year, the three National Lead Poisoning Prevention Week themes are Get the Facts, Get Your Home Tested, and Get Your Child Tested. For more information about National Lead Poisoning Prevention Week, including resources for your program, you can visit www.hud.gov/healthyhomes. This webinar today is Get the Facts on Lead Poisoning. This webinar will last approximately 45 minutes with 15 minutes at the end for questions. At the end of the webinar, you will be given information on links to additional resources for your program. We will be recording this webinar and posting it for your later viewing if you prefer. Finally, your microphone will be muted during the presentation. If you have questions during and after the presentations, please feel free to post them in the question window and I will read them to the presenters. This is important because we have over approximately 200 people on the webinar and it will get pretty noisy if everybody is unmuted. So I'd like to now introduce our three speakers today. The first speaker is Dr. Tim Dignam, who works for the CDC National Center for Environmental Health in the Division of Environmental Health Science and Practice, where since January 2018, he has been the acting chief of the Lead Poisoning Prevention Program. He was CDC's Deputy Associate Division Director for Science from 2014 to 2018. Tim worked as an epidemiologist in the Child Lead Poisoning Prevention Program from 2000 to 2014. He has authored more than 15 peer-reviewed articles on the topic of lead exposure and child health. Our second speaker will be Dr. Warren Friedman, who is the Senior Advisor in HUD's Office of Lead Hazard Control and Healthy Homes. He works on environmental health and safety of the built environment. This includes policy development and monitoring, research with over 36 peer-reviewed publications, strategic development, and regulatory review and development. He chaired the American Industrial Hygiene Association's Indoor Environmental Quality Committee and its Practice Standards and Guidelines Committee, and was the Environmental Information Association's president. He is also a certified industrial hygienist. And our third speaker, Ms. Michelle Price, is the chief of the Lead, Heavy Metals, and Inorganics branch in the National Program Chemicals Division. The division plays a key role in the implementation of EPA's lead poisoning prevention programs. This includes the Renovation, Repair, and Painting Rule, the RRP rule, the lead-based paint activities, inspection, risk assessment, and abatement rule, and the real estate disclosure rule. So, we're going to ask Tim to go ahead and start your presentation. Tim, are you there?
I am here.
So I don't see your presentation. Oh, there it is. Here it comes. Okay. Welcome, Tim, and we look forward to your presentation.
All right. Thanks, Michael. Can you see the presentation and hear me okay? All right. I'm going to take that as a yes. Good afternoon, everybody. I'm Dr. Tim Dignam, Acting Chief of the CDC Lead Poisoning Prevention Program. During this National Lead Poisoning Prevention Week webinar, I will provide an overview of lead poisoning prevention information. Our theme today is Get the Facts, and I'm happy to join Warren and Michelle in this webinar. During the webinar, I will answer the following questions. What is lead poisoning? Is lead poisoning still a problem in 2018? How does lead affect children's health? How are U.S. children exposed to lead? What are risk factors for lead exposure among U.S. children? What are current trends in lead exposure among U.S. children? And how can you prevent lead poisoning? And what is the role of CDC in lead poisoning prevention? Lead is a toxic poisonous metal. Exposure to lead can result in lead poisoning, which occurs when lead enters the bloodstream and builds up to toxic levels. In general, poisoning happens when a substance negatively affects normal body functions. Even low levels of lead in blood have been shown to affect IQ, ability to concentrate, and academic achievement. It's difficult to say whether a child has been poisoned simply based on the child's blood lead level. There are many factors such as the source of exposure, length of exposure, underlying susceptibility like child's age or nutritional status or genetics, and these affect how the body handles foreign substances. The key message is no safe level of lead has been identified for children, and children can be given a blood test to measure the level of lead in their blood. Today, children rarely exhibit signs and symptoms of acute lead intoxication, such as seizing and being comatose. However, this does not mean that lead exposure is doing no harm. The impact of lead is unseen, and it's often referred to as a silent epidemic. In 2018, childhood lead poisoning is considered the most preventable environmental disease among young children, but unfortunately over 500,000 US children have blood levels above 5 micrograms per deciliter, the reference level at which CDC recommends public health actions be initiated. A simple blood test can identify elevated blood lead levels. Reducing childhood blood levels can prevent permanent damage that potentially can last a lifetime. The U.S. Department of Health and Human Services and CDC are committed to eliminating this burden of public health. The key is simple. It's to keep children from coming into contact with lead. There are still many sources of lead in the United States. For example, about 24 million housing units still contain significant lead-based paint hazards, and about 10 million housing units have lead water service lines. Children are at greatest risk of adverse health effects due to lead exposure. And this is because children have unique behavioral factors such as mouthing and crawling. Their body systems and detoxification processes are still developing. And children absorb more lead per body size compared with adults. Even low levels of lead in blood have been shown to affect child's IQ, ability to concentrate, and academic achievement. And lead exposure in children can cause numerous things, including damage to the brain and nervous system, learning and behavior problems, slow growth and development, and hearing and speech problems. The main routes of lead exposure are inhalation and ingestion, and numerous studied health outcomes exist, and they include neurological, renal, cardiovascular, immunological, reproductive, and developmental. Neurological effects of lead are of greatest concern because effects are observed in infants and children and may result in lifelong decrements in neurologic function. The nervous system is the most sensitive organ system for lead exposure in children, and there is a wide range of neurological effects associated with lead exposure, some of which unfortunately may be irreversible. How are children in the United States exposed to lead? The most common sources of lead exposure today among US children are lead-based paint and lead-contaminated dust. Lead-based paints were banned in 1978, and generally older houses have more lead content in their paint. In the United States today, deteriorating lead-based paint in older homes and buildings is the most highly concentrated and significant source of lead exposure among children, and estimates have accounted for up to 70% of elevated childhood blood lead levels as that source. Lead dust and paint chip hazards arise through the following: friction between interior surfaces, such as door frames or windowsills, home renovations that disturb lead paint, and transport from outdoor sources such as soil and exterior paint. Lead can be transferred from surfaces to hands and ingested by young children via normal hand-to-mouth behavior. So what are other sources of lead exposure that are still important? Occupational exposure. Workers can inadvertently transport hazardous materials into their vehicles and homes on their own tools and clothing and hair and skin, and create an exposure hazard for their children. Lead contaminated water. Measures taken during the last 2 decades have greatly reduced exposures to lead in water, but these measures include actions taken under the requirements of the 1986 and 1996 amendments to the Safe Drinking Water Act and the US EPA's lead and copper rule. But even so, lead still can be found in some metal water taps, interior water pipes, or pipes connecting a house to the main water pipe in the street. Lead found in tap water usually comes from corrosion of older fixtures or from lead solder that once connected the pipes. When water sits in leaded pipes for several hours, lead can leach into the water supply. Lead has also been found in some traditional folk medicines used by Indian, Middle Eastern, West Asian, and Hispanic cultures. Herbal and Ayurvedic remedies are another source of lead exposure, as are imported candy and candy wrappers, some imported spices, some imported toys, and traditional pottery from manufacturers in Mexico. Children at higher risk for lead exposure include those that live in pre-1978 and or live in pre-1978 poorly maintained rental properties. They're sometimes lower income or members of a racial ethnic minority group, sometimes recent immigrants, live in pre-1978 housing that's having renovation or remodeling, have siblings, housemates, or playmates with known lead exposure, have parents or household members who are exposed to lead at work or through hobby, live near active lead and other types of smelters, battery recycling plants, or other industries likely to result in atmospheric lead release, and they may also be exposed to lead through various consumer products. Disparities in community and neighborhood lead exposure exist today. The remaining affected children are not randomly dispersed throughout the population. They are primarily concentrated in neighborhoods characterized by older homes, lower family incomes, lower housing values, higher population densities, higher proportions of rental properties, higher proportions of minority, immigrant, and refugee residents. Special attention can be considered to testing and preventing exposure of these special at-risk groups. This map shows the number of children aged 1 to 5 years with blood lead levels greater or equal to 5 micrograms per deciliter in 2010 using Public Use Microdata Area, or PUMA. PUMAs are areas designated by the United States Census Bureau containing a minimum of 100,000 people. Roberts and colleagues developed a statistical model, which was published in 2016, to estimate the prevalence of blood lead levels greater or equal to 5 micrograms per deciliter among U.S. children. Roberts and colleagues found that lead poisoning potentially impacts children in all regions of the United States. And based on the findings of the research, they estimated that the Northeast and Midwest regions identified the highest number of lead-exposed children. The South had the highest number of children with lead exposure, yet only identified approximately 25% of them. And the West area of the United States had the fewest number of lead-exposed children, but performed the poorest at identification, with only 22% of lead-exposed children being identified. This slide presents current trends in lead exposure among U.S. children. Child blood lead levels, as evidenced by CDC's National Health and Nutrition Examination Survey, or NHANES, continue to fall. Significant racial and socioeconomic disparities continue to exist today. Not all, about 67%, of Medicaid children are tested for blood lead, even though it's required by law. About 60% of children with blood lead levels greater or equal to 5 micrograms per deciliter are tested or identified. Further, less than 20% of young children who should be tested are tested by healthcare providers. And adverse health and developmental effects are being identified at increasingly lower blood lead levels. So what is your role in preventing lead poisoning? Well, today's theme is Know the Facts. And the key ones are: there is no known safe level of lead in children. Inequitable distribution of lead hazards continues to exist, and many high-risk children are not being tested and not receiving the opportunity for appropriate follow-up intervention services. You can also create awareness and a sense of urgency to prevent lead exposure in your community. Organization and partnering. Examples of partners include local public health and safety officials from programs such as Head Start, Women, Infants, and Children, other health-related programs. There's also emergency medical services, the fire department, the Poison Control Center. You can also partner with educators within the healthcare community, such as hospitals, clinics, urgent care centers, family medicine, and pediatric practices. Lead Poisoning Prevention Week is our time to renew and refocus efforts to prevent lead exposure in children. What is CDC's role in preventing lead poisoning? The Lead Contamination Control Act of 1988 authorized the CDC to initiate program efforts to eliminate childhood lead poisoning in the United States. And the CDC Childhood Lead Poisoning Prevention Program was created as a result of this act. Our vision is to eliminate childhood lead poisoning as a public health problem. CDC's Childhood Lead Poisoning Prevention Program's mission is based on the Healthy People 2020 goals of reducing blood lead levels in children and the differences in risk based on race and socioeconomic status. Our key strategies are to strengthen blood lead testing and reporting, to strengthen surveillance, to strengthen linkages of lead-exposed children to recommended services, and to strengthen targeted population-based interventions. And Dr. Sharundra Buchanan from CDC will expand on these strategies tomorrow during her webinar, Get Your Child Tested. The U.S. government has renewed its pledge in the Healthy People goals to eliminate lead poisoning as a public health problem by 2020. The objectives are to reduce blood lead levels in young children by 10% and to reduce by 10% the geometric mean blood lead level in young children. These objectives have been met. However, there are future challenges, particularly from the inequitable distribution of lead hazards in some communities throughout the United States. Additionally, blood lead testing of at-risk children and the quick medical management of children requiring follow-up is an area and an opportunity to improve. So in summary, lead poisoning in the United States is still a problem in 2018. As I've mentioned, about 500,000 children have blood lead levels high enough to damage their health. Approximately 23 million housing units and 10 million housing units have lead water service lines, and 23 million housing units have significant lead-based paint hazards. Disparities in blood lead levels by income, race, ethnicity, and geographic location still exist today. Many high-risk children are not being tested and therefore not receiving the opportunity for appropriate follow-up services. 2018 Lead Poisoning Prevention Week is a time to renew and refocus lead poisoning prevention efforts. And I appreciate everybody's time today.
Thank you very much, Tim. So I'm going to go ahead and switch the presenter to Warren. Warren, go ahead and accept the screen again. While we're waiting for that, I want to remind everybody that if you have questions for any of the presenters, Warren, it looks good. You're up now. Let me unmute you. But I want to remind everybody that at this point, if you have questions, just go ahead and use the questions window and type them in, and then I will verbally read the questions at the end of the presentations to the presenters, and they will be able to answer you. So Warren, we're looking forward to your presentation.
Thank you, Michael, and thank you, Tim, for a very good initial presentation. This is Warren Friedman from HUD's Office of Lead Hazard Control in Healthy Homes. For short, we call it the Lead Office or the Healthy Homes Office. A lot easier to say that way. So I want to build on what Tim had discussed with you and focus on the federal role in lead poisoning prevention. And what CDC does is non-regulatory, and what I'm going to be discussing is regulatory. And then you'll be hearing from Michelle Price of the EPA about particularly important regulations and programs. So the question is, why is there a federal role in this issue? Well, it's still a problem. And we knew about this problem a long time ago, going back as far as 1897. In Australia, scientists identified lead paint as the reason that children had elevated blood lead levels, and back then were particularly severe. As Tim had noted, fortunately, we almost never see cases that are that severe anymore, but the connection was made. In 1922, several European countries started to prohibit its use, and this continued through the 20s and 30s. At the same time, science, in particular the study of toxic substances, toxicology, advanced. And as Tim also mentioned, we know now more and more about the effects of lead at lower exposure levels than we did in the past. Now, as this was happening, the federal government began to get involved through laws. In 1971, the Lead-Based Paint Poisoning Prevention Act, sometimes informally called the Lead Act, was put in place by Congress, and it had requirements for the Department of Health, Education, and Welfare, and that agency, of course, has split. It's now Health and Human Services and Department of Education, but back then they were combined. And it authorized grants for childhood lead poisoning prevention programs. CDC continues its support for those programs today. The HEW grants also were authorized for promptly eliminating lead-based paint in housing, and at that point, 1% lead in the paint was the threshold that was specified. The Act also provided grants for HUD to conduct research and development on ways of removing lead-based paint effectively. With respect to federally assisted housing or federal assistance to private housing, the law prohibited the use of lead-based paint, again at that 1% level, in any federally assisted new residences or federally assisted rehabbed old residences. Now, I should note also that in 1971, the same year, because there was a lot of activity then, Massachusetts enacted a primary prevention law. Primary prevention is preventing somebody or a group of people from getting a condition. And they took the approach that housing property owners must permanently control certain lead-based paint hazards if there's a child under age 6 who is living there or has rented and is going to be living there. And this is a model that wound up being used down the road, such as in 1992, at the bottom, there's a mention of Title 10, which I'll get to. But even before then, the following year, 1972, after the 1971 Act, Congress went and expanded the ban of lead in paint being used. So it was not only the assisted housing, but also unassisted housing. So this was controlled by Congress at 0.5%, down from 1%. Another way of referring to 0.5% is 5,000 parts per million. In 6 years after that, 1978, lead-containing paint was banned by the Consumer Product Safety Commission at the 600 part per million level from new house paint and from paint on consumer products, especially children's consumer products. Then in 2008, Congress lowered the 600 parts per million down to 90 parts per million. Now, in 1992, as I mentioned, there was a law enacted that covered lead paint safety in a number of ways, and it now provides the main lead paint law for both HUD and EPA and our occupational safety and health colleagues. So this law, Title 10 for short, is one under which a number of policies, regulations, and programs were enacted. So the role of Congress in that case and in others is that Congress sets up requirements and in some cases sets up limitations, what can be done, what can't be done by either federal agencies or state, tribal, and local agencies and governments and or the general public. And so, for example, the amount of lead in paint that could be put into housing was restricted by statute. Now, typically, major federal legislation requires that an agency, or if it's broad enough, several agencies, issue more detailed regulations on how the rules should be implemented. And with respect to lead paint, there are 5 main sets of rules that are shown for the Consumer Product Safety Commission, the ban that I mentioned, HUD Lead Safe Housing Rule on HUD-assisted and other federally assisted housing, EPA's lead-based paint activities rule, and other rules, and Michelle is going to be discussing those. And then EPA and HUD jointly have a lead disclosure rule, and both agencies are involved with enforcing that in terms of older housing and the information that has to be disclosed when the housing is being sold or rented, as I'll discuss a little bit down the line here. And then for OSHA, lead in construction was required by Title 10, and this is not only new construction, but it's also renovation and other activities that affect housing, but it's broader than housing. The OSHA rule covers any construction, housing, or not housing. Now, the role of the federal courts, the third branch of federal government, is to hear cases, and these could be brought by federal agencies against someone whom the agencies, such as HUD or EPA or CPSC, thinks are violating the lead statutes. And depending on what the lead statute is, there could be civil money penalties, and we think of that as a fine for short. The court could prohibit the party from doing the thing that they had been doing, can't violate the law any longer. Another approach, in certain cases, there are criminal penalties. If you lie in certain situations to the federal government, or you withhold information that you were required to provide, in some cases it's possible to have criminal penalties applied. The federal courts can also hear civil cases involving federal law where one member of the public sues another member of the public, or they're also able to hear petitions where a member of the public asks that the federal government do something. And the lead disclosure rule, for example, had a provision, lead disclosure statute had a provision saying that the public could ask for certain actions to be taken by HUD or EPA. So going on further, what are agencies doing? And you've seen the list of agencies. They're again down there in terms of these regulations. And I want to supplement this by noting the work that CDC does in supporting state and local health departments and having its own outreach is very important. It's not a regulatory effort, so it's not. They are providing guidance in a non-regulatory manner. So in the Code of Federal Regulations, which is where all the federal rules are assembled, the jargon is there are titles and then parts within the titles and then sections within the parts. So we wind up with numbers and letters used to tell people where to find things. And the CPSC ban on lead containing paint, HUD's Lead Safe Housing Rule, EPA's rule, the lead disclosure rule, and the OSHA rule, all are found in certain titles and certain parts of the Code of Federal Regulations. There's a website, ecfr.gov, for the Electronic Code of Federal Regulations.gov, where people can search for specific rules that have been issued by the federal government. It's a good way to find these rules and other rules, whether they're lead or other topics of interest. The lead disclosure rule is one that is sometimes known as 1018 because that was the section of Title 10 which enacted it. And this is found within Title 24 of the Code of Federal Regulations in Part 35. And Subpart A of Part 35 is the place where the lead disclosure rule is found. And under this, most pre-1978 housing, in other words, housing that may have lead-based paint, is subject to lead disclosure when it is being sold or it is being leased. And this lead disclosure rule is jointly enforced by HUD and EPA because Section 1018 of Title 10 specifically told both agencies to issue a regulation. What they decided immediately was that they would issue the identical regulation. And so it appears in two places in the Code of Federal Regulations, but the substance is the same. And the disclosure requirements are to provide a pamphlet that EPA, along with the Consumer Product Safety Commission and the Centers for Disease Control and Prevention, developed, and a property owner of housing who is selling or leasing it, and the housing is pre-1978, has to provide that pamphlet called Protect Your Family for short, and I'm sure Michelle will give you more information on it. There's a specific warning statement about the hazards of lead, and the housing owner has to provide known information about the presence of lead-based paint and lead-based paint hazards, that they are there and where they are. So that's the information that the seller or landlord knows. Then, in contrast to the previous picture where the ostrich was hiding its head, because sometimes people say they don't want to know, if the housing is federally assisted, then the requirement is that if it's pre-1978 and it may have lead-based paint, then there are affirmative requirements to protect the children through a prevention program. Not merely do they know anything or not know something, they have to take action. Now, there are various requirements based on Title 10, varying by the type of assistance, in some cases the amount of assistance. That's the federal money that goes into helping pay for the housing for especially low-income families. There are some exemptions, such as if it's built after 1977, so there would not be lead-based paint, or a lead-based paint inspector says there is no lead paint. And there are a couple of other exemptions based on who lives there. The basic approach to the Lead Safe Housing Rule is test, and this includes visually observing, as well as in many cases doing specific testing of the content of the lead in the paint, and also seeing what kind of condition it's in. Then treating, so that you go from a mess to something nice. And we see here the cleanup, the repair of the window sash, the window frame. Then test again afterward. Make sure that the work was done in a way in which no debris, no dust from that cleanup job got onto floors or windowsills or anywhere else, so that it could be a problem for the family. And then tell the family what happened, so that when there was work, when there's inspection, the family of the assisted housing knows. Finally, on an ongoing basis, keep things in good condition so that the problem does not arise. And when it does arise, the family tells the landlord, or if that doesn't work, the landlord is required to regularly assess the condition of the assisted housing So there's several ways to follow up. Now, the Lead Safe Housing Rule applying to assisted housing that's pre-1978 is linked to the EPA standards for dust lead hazards, EPA standards for soil lead hazards. We also use the HUD guidelines.
Warren, sorry to interrupt. We actually lost your slides just now. I think you might have hit a button to.
Oops.
How many more slides do you have left?
Just 3.
Okay. I'm not sure if we're going to be able to get you back right away. Could you do me a favor? Could you go ahead and sort of summarize? And I think I can come back to you. I'll remake you the organizer, but you actually logged yourself out, except for you're on the phone. So I'm a little bit concerned about bringing your slides back. So if you could go ahead and sort of summarize what's on those slides,
sure.
I think we'll be
don't
okay.
worry
Sorry
about
about
it
that.
at all.
Okay.
That's fine.
Okay.
Okay. So in the Lead Safe Housing Rule, as I said, applying to federally assisted housing, we use EPA standards for dust lead hazards. What is a dust lead hazard? How much lead in the dust? A soil lead hazard. How much lead in the soil becomes a hazard to health. We also published guidance called the HUD guidelines that's used for how to do things, the procedures. And in our Lead Safe Housing Rule, we also cite the CDC definition of elevated blood lead in terms of deciding when particularly stringent action is needed. Then we go within the Lead Safe Housing Rule. As I mentioned, there are specific requirements for specific kinds of housing assistance, and rather than go through all detail, I'll note that on our website, hud.gov/lead, we have the rule itself, we have interpretive guidance so people can follow up, get more information than they might have otherwise. And finally, and as Michael said, the slides will be posted, we have our website, we have a lead regulations hotline at leadregulations@hud.gov. Also, we have the phone number 202-402-7698, and we help EPA in supporting the National Lead Information Center that EPA runs at 800-424-LEAD and epa.gov/lead. There's a lot of information out there. So I turn it back to Michael. Thank you.
Thank you so much, Warren. And as Warren mentioned, we will be posting the slides also, so you will be able to see those slides. Darlene, I do see your I'm sorry, for Michelle and Darlene, I do see your presentation, but you need to go up to the top where it says display settings and change it to duplicate so we just see the perfect. Okay, so we'll now hear from Michelle.
Okay, thanks, Michael. This is Michelle Price at EPA, and I'm going to talk about our lead-based paint program and give you an overview and kind of an update. And I'm going to just skip over to slide 3 and kind of quickly give you, try to not duplicate some of what Tim and Warren have already talked about. So under the 1992 Lead-Based Paint Poisoning Prevention Act, which we call Title 10, EPA has a number of responsibilities. And so the key responsibilities under that act are for us to regulate lead-based paint activities like abatement, inspection, risk assessment in target housing and child-occupied facilities. We also regulate renovation, repair, and painting activities in target housing and child-occupied facilities. We evaluate if hazards are, we're working to evaluate if hazards are created by renovation, repair, and painting activities in public and commercial buildings. And if so, we're supposed to promulgate regulations to regulate those hazards. We are also, another obligation under the law is for us to regulate the identification and or de-leading of lead-based paint from bridges or structures or superstructures. We established hazard standards pursuant to TSCA Title 4, Section 403, and we completed that in 2001. We continue to work with authorized state and tribal programs that are interested in administering the lead-based paint program. And as HUD or as Warren and Tim have both noted, we work with their organizations to educate the public about lead poisoning prevention. And we also jointly work with HUD to regulate information disclosure standards. So that's kind of an overview of our responsibilities under the statute. So to give a little bit more information about the training, certification, and work practice regulations that we have two major regulations that address the identification and abatement of lead hazards. The abatement program, and then we also have the renovation, repair, and painting program. Both of those regulations establish certification and training requirements for both individuals and firms, as well as accreditation requirements for training providers and work practice standards to make sure that the work is done in a way that's lead safe. Both of those programs are delegatable to states, tribes, and territories, and we work closely with our Office of Enforcement and Compliance Assistance to enforce the regulatory requirements of both of those programs. And many folks out there have probably worked with our regional offices. There's a regional lead coordinator in each of our 10 EPA regions that work closely with the states and tribes and territories. And they also are the leads for working with the states and tribes on the grants that we have available every year. With regard to the abatement program, that requires individuals that conduct inspections, risk assessments and abatements in most residential housing to be trained and certified. All of the work has to be conducted according to work practice standards. And this program is delegated in 39 of the states, so EPA only implements the program in 11 states. So 39 states, District of Columbia, Puerto Rico, and 4 tribes are authorized to administer the program. And a key component of, or part of what was part of Title 10 is states have to be authorized to implement the abatement program in order to qualify for HUD grant funds. So that's part of the reason probably we have so many states that are authorized for the abatement program. Okay, so the renovation, repair, and painting program. This is a program where firms performing work in pre-1978 homes and child-occupied facilities have to be certified and use trained renovators. And in the case of this program, we have 14 states and the Bois Forte tribe that are currently authorized to administer the program. As of the end of August, there are about 88,000 certified firms across the country, including in the states that are authorized. And we operate a program, an online database, and a central data exchange, a place where you can apply for certification for individuals, firms, and training providers. The information disclosure program requires renovation contractors to give a pamphlet about lead hazards to tenants and homeowners no more than 60 days prior to beginning work. And then the joint EPA and HUD regulations require seller or lessors to disclose information on the presence of lead to prospective buyers or lessees. So public education outreach, I mean, there's kind of a lot here, and we're a little, we've got only a quarter of an hour here left to finish this, so I'll try to summarize, but there's a lot of information on our website, which I think we have at the end of the presentation. But the goals of the public education and outreach program are to increase public awareness of lead exposure hazards and lead poisoning prevention. We have brochures and other materials on our website, as I think Warren mentioned, the National Lead Information Center. We've all talked about this week, the annual October recognition of Lead Poisoning Prevention Week, and the lead website. Another key goal of our program is to increase the number of lead-safe certified firms and promote consumer demand for lead-safe certified contractors. If consumers don't ask for contractors that are certified, it's not going to be in their interest to do it. So we've developed marketing tools for contractors and consumers. And we also had a initiative in 6 cities in 2016 and 2017 to try and work to increase the lead-safe certified firms and get more training out there in those cities. So current regulatory activity here at EPA, a lot of folks are interested in the dust lead hazard standards rulemaking. I'm not going to go through all this legal background because you can see it on the slides, but we'll just go ahead to the next slide and just summarize that In June of this year, EPA proposed to change the dust lead hazard standards from 40 micrograms per square foot and 250 micrograms per square foot to 10 and 100 on floors and windowsills, respectively. And these standards apply to most pre-78 housing and child-occupied facilities. And we did not propose to make a change to the definition of lead-based paint because we lack sufficient information to support such a change. And I should note, we plan to work to finalize that rulemaking by June of 2019. We'll probably get a question on that, so I might as well just put it out there. Public and commercial buildings, we had a lawsuit back in 2008 that we failed to meet our legal obligations to address renovations in public and commercial buildings. And at that time, and it's been changed several times over the years, but there was a settlement agreement that included the establishment of a timeline for actions on renovations of public and commercial buildings. And EPA just at the end of September completed an industry survey on renovations performed in public and commercial buildings, and we continue to work on modeling approach for estimating exposures and incremental health effects from lead due to RFP activities in public and commercial buildings. Okay, so we have a few slides on the lead rules. We have the lead and copper rule. That's just my slide. Yeah, so we have the lead and copper rule, and EPA is working on revisions to update that rulemaking. We're currently evaluating input we received from our state, local, and tribal partners, as well as the best available peer-reviewed science to ensure that the rule reflects the best ways to improve public health protection. And we anticipate releasing the proposal in 2019. And then an update on the lead-free rule. EPA is currently working to revise regulations for the use of lead-free infrastructure to codify the new and more stringent definition of lead-free and to clarify how manufacturers can meet these new lead-free standards. The proposed rule was issued in 2017, and EPA is working to address comments and finalize that rule in 2019. We also have WIN grants, and these are new grant program that will directly target lead-related issues under the Water Infrastructure and Improvements to the Nation Act. And there are three programs mentioned here. There's the Assistance for Small and Disadvantaged Communities program, and this is a $20 million grant that will allow EPA to partner with states to meet the needs of rural and disadvantaged areas. There's the Reduce Lead in Drinking Water program, and this is $10 million to focus on providing funding to reduce lead in drinking water systems, including replacing lead service lines. And then there is the Lead Testing in School and Child Care program drinking water program, and this grant is to support lead testing at schools and child care centers. And states, that was just announced, really towards the end of September. States that choose to participate in this voluntary grant program have to submit their letters of intent by January of 2019. So that's a $20 million grant program. Okay, so then there is the 3 T's for reducing lead in drinking water in schools and child care facilities. So obviously children are really vulnerable to lead, as Tim explained, and they spend a significant portion of their day in schools or child care facilities. And testing drinking water where they spend much of their time and reducing sources of lead are extremely important to reducing their potential exposure. So EPA's training, testing, and taking action document assists schools as they work to implement their lead drinking water prevention programs. And then we have in October, earlier this month, we released the updated 3 T's for reducing lead in drinking water in schools and child care facilities. And together, these new grants and the 3 T's provide states and schools with the necessary tools to help protect children from lead in drinking water in our schools. And so for more information, you can go to these parts of EPA's website. There's a lot of information about the lead-based paint program, as well as the WIN grants, the lead and copper, the lead and water rulemakings. are available at these two websites. Thank you.
Okay.
Okay, so what I'm going to do now, I'm going to unmute our speakers so that everyone can have a chance to speak. So, Warren, are you still with us?
Yes, I am.
Fantastic. Okay, so I do have some questions I want to ask the panelists. I just want to check one more time that I have unmuted everybody. I have one more person to unmute here. Okay, so Yvonne, you're also unmuted too in case there's any questions on lead in water. So let me go back to the first question I got. And again, if everybody will use the questions window to ask questions, we'll try to do as many as we can before 3 o'clock Eastern time. So the first question came in, and I think this is for everybody. What is being done to assure that we do not see a lead crisis like we saw in Flint, Michigan, with years of high lead concentrations? Does anyone want to start answering that one?
So sure, this is Eric Helm, by the way. I was not a presenter, but I'm in the Office of Water, and I'm the team lead for the lead and copper rule revisions.
Yeah, at EPA.
At EPA. One of the primary drivers to revising the lead and copper rule, of course, was the situation in Flint. So we are currently investigating changes to the regulation, changes to our requirements around lead service line replacement, changes to our monitoring regime under the lead and copper rule, changes also to how public education is conducted that would help to alleviate an issue such as Flint. There also has been legislation that's been enacted that requires EPA if we obtain material that or tests that are above the action level. We have certain requirements now that we must notify the state officials and give them a very small window to react to this, and then we have requirements of our own to notify the public if the system or the state has not implemented some sort of public education and a fix, or a plan for a fix.
Thank you. So let me ask the next question. The next question is more of a comment, but I think it applies to all three presenters also, and it's a little bit lengthy, so I'm going to try to read through it pretty quickly here. This is a plea for HUD to update or remove the requirement of 24 CFR 35-930 D3. This is the regulation that requires abatement if per unit funding exceeds $25,000. The person who asked the question has actually been in this industry for 18 years and is concerned that the $25,000 rule actually causes more harm, and is wondering whether it would ever be updated for the cost of living or other reasons, or whether that rule might be eliminated.
Thank you. This is Warren. A very good question. The $25,000 limit is in Title 10. It's a specific fixed number. So HUD does not have the discretion to increase it for inflation. If Congress were to amend that number, such as providing for an inflation factor, then we would revise the Lead Safe Housing Rule to accommodate that. And I should note that not only in the specific section that you mentioned, but there are other places where fixed numbers are used. And so if those would be adjusted by Congress, then we would adjust the rule. Thank you.
Thanks, Warren. So we have a couple of other questions, and I want to remind people that we do have a little bit more time for questions if you want to type them into the questions window. During the presentations, you all mentioned the funding that goes to lead poisoning prevention, and one of the comments was $10 million for a program that provides for replacing lead service lines does not sound like a lot of funding. So I'm not sure how to address that, other than, do we even have an idea of how much it would cost to actually replace those lines, more than the 10 million? I know it's going to be an astronomically high number, but I was just curious if there's ever been a study as to what that cost would be. Does any of the presenters want to answer that?
Yes. So I think two folks from EPA would like to have a little bit of input here, but I'll start. This is Eric Helm again. So as part of the analysis for the lead and copper rule revisions, EPA has done an analysis to try to determine the cost of replacing lead service lines across the country. Now, estimates of lead service lines, or the number of lead service lines out there, range between 10 million and 7 million, and there's really a lot of uncertainty around that number. But average lead service line replacement costs are in the $4,500 range for a single lead service line. So that gets you into values of total values of around $70 billion. As part of any regulatory action, of course, we have to take these costs into account. But for the LCR, we are exploring different time frames for requiring lead service line replacement, or other mechanisms in the rulemaking to help reduce lead concentrations that don't require the immediate immediate removal of lead service lines. I think that Ivan from EPA may also have some extra information, particularly devoted towards the WIN Act grant.
And you mentioned that there's going to be another person that might want to answer that question also, or are they okay with your answer? Yeah.
Yeah. Can you guys hear me?
Yes.
Yeah. Yeah. Okay. Eric's correct. So the WIN reduction in lead act, or the WIN reduction in lead grant, which is section 2105, we understand it's $10 million that was appropriated in FY18. And we understand that doesn't sound like a whole lot of money for lead service line replacement, but what we intend to do with this $10 million is, one, to make it a competitive grant or a competitive award process. So we're going around towards an RFA in order to lead us to projects or proposal projects that could provide meaningful improvements to water systems, including lead service line replacement. But activities or projects such as planning, testing, and mitigation activities are part of the types of eligible projects that we're looking to award for this particular grant. In addition to grants to homeowners for private side lead service line replacement, all of which we're sort of prioritizing with focusing on disadvantaged communities with an action level exceedance in the last 3 years to address lead levels in schools, daycares, or other facilities that primarily serve children. As I stated, it may not seem like a whole lot of money, this $10 million. We're trying to make it to try and span out to projects that provide meaningful improvements. In addition, we're working with other federal partners to see how they can help us holistically, not only just use this money, but monies that they may have within their agencies and their departments that could contribute to these meaningful improvements. This may be just a part of the funding that is provided for projects or for communities that need remediation or want a meaningful improvement. But we're focusing and communicating with our other federal agencies to see what they can do to pull in and help sort of create this holistic improvement.
Great, thank you so much. So we'll take a couple more questions. This one probably is for Tim, unless someone else wants to answer it. It says CDC mentioned that 67% of Medicaid patients are tested for lead, and the person was asking where can they find data specific to their state?
Yeah, that figure that I cited was a national estimate from a MMWR that came out, mortality morbidity weekly report that CDC produces. For state-based questions on that, I would refer them to their state Medicaid office. And a lot of times, state lead poisoning prevention programs and the state Medicaid programs engage in data linkages to determine the screening and prevalence and testing rates that are occurring, and that would be your best source of information for your state.
Okay, next question. Is there an intent to change the definition of LBP to less than 1 milligram per square centimeter if the science and or testing methods allow it?
This is Warren from HUD. If I can start off, and maybe EPA colleagues may want to join in. HUD is looking at the definition. The Lead Act that I mentioned earlier talks about HUD looking at the definition. And so we've begun a project, we began it last year, to look at the definition to see whether, based on technology and the medical effects of using a different definition, it would be reasonable to change the definition. So we're in the studying phase, but it is something on our plate that we're looking at.
Thank you, Warren. So I don't have any more questions that have come in, and it's at the end of our webinar. I want to thank our presenters, Tim, Warren, and Michelle, for a fantastic presentation. I want to remind everybody that we were recording this webinar, and it will be posted on the HUD Healthy Homes website on a link, and you will be given information through an email about where that's located when it is posted. So again, I want to thank everybody for coming today and attending this webinar, and hopefully you will be attending the rest of the webinars this week for Lead Poisoning Prevention Week. Thank you, and we will be stopping the webinar.